you so much for calling in. I understand. This is cool. I love what he said to the call screener. Your treatments have been very helpful. Well, thank you.
Yeah, he asked if they were really helpful, but you fixed it. With mine, they've been helpful to me because you fixed it about 5 years ago, and I haven't needed to see you since.
Well, I'm sorry we haven't seen each other since.
It works well for me, though.
Well, that's amazing.
And my wife has hip issue, which I think it's been about a year since you shot her, and she really doesn't have many complaints now.
We have to let this. We need to let everybody know that the word "shot" it doesn't mean with a gun. It means injection.
Yeah.
It's like shooting up.
Yeah,
we use that as a term.
Exactly. Although,
so, is your wife also doing well?
Injection. She's doing well. Yeah, she's doing well also. But I think you saw her about a year ago. So with me, it was kind of amazing to me because I had one of my knees. I forget which one. That shows you how much you fixed it because I don't even remember the pain in which knee. And then my left hand, the back of my left hand, and that was maybe 4 or 5 years ago. And I was only in once or twice, and then nothing after that. It just fixed it. So the screener asked me, said, "Was the treatment helpful?" I go, "Helpful? It fixed it. I guess it's helpful." I would say it's, I would say that was helpful.
Well, very, very cool. Did I ever you probably don't remember what your diagnosis was?
I don't know what the diagnosis was.
Well, that means...
I really don't remember.
Okay. Well, that's even better. And the thing I want people to know who are listening, Ken's got a great example of, he had his knee done first and then his left hand. And we treat the whole body. There are many doctors that will only treat knees and shoulders or hips or something like that. But I treat necks and backs and little teeny areas that other doctors don't even know exist. And the reason for that is I was trained a long, long time ago when doctors really would inject anything on the body that had a problem. And recently there are workshops that are being done on regenerative medicine all over the world where people are being trained how to treat, let's say, a knee and a shoulder and a hip, and that's about it. So if you have something that your doctor says can't be fixed, and I hear it every day, I've been to so many doctors, they say that they don't know what to do, check in. We take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, and for people without insurance, we take Care Credit. It's a credit card we can help you get. And it doesn't pay for these treatments usually, but at least will pay for your first visit and some other things that we can do.
Also, one of them he sent me for an MRI, and I think it was across the street, across Wilshire Boulevard, and, my insurance paid for that for sure. So, and I don't know, I'm suspecting that was on the knee rather than the back of the hand, but so there is some diagnostic stuff that Medicare, of course, would pay for.
Absolutely. So, anyway, I appreciate your call, Ken. We're going to go to Jay, who's got back pain. God bless you, Ken.
Yes, thank you so much for your call. Our number is 866-870-5752, and Jay in Cyprus is with us.
Hey, Jay, Dr. Marc Darrow here. How are you today?
Hello.
Hey, do you hear me?
Hello.
Hello.
Jake?
Yes, can you hear me?
Oh, yeah.
Yeah, we hear you fine, Jay.
Can you hear me?
Yes, we can hear you.
Yes, do you hear us?
Okay, I hear you fine. I've listened to you probably a long, long time, and I was going to call and I haven't. But anyways, I was scheduled for next Friday to do injections on L3, 4, and 5.
Yes.
And last Friday, I had my muscles on both of my legs locked up like Charlie horses.
Yes.
And I had pain in my legs that I'd never. It was so excruciating.
Okay.
And I finally got it worked out.
Well, nice. How did you work it out?
So they canceled it.
How'd you work it out in 15 minutes?
just moving, inches at a time.
Wow, good for you.
The pain was so bad that I'd move, a little bit, and a little bit, and a little bit.
Well, you talked about your legs, but do you have back pain?
Yes, I have an MRI shows there's nerves at L3, 4, and 5.
Okay. Now, do you have back pain? Do you have back pain or do you have leg pain?
Both.
You have both.
Actually, the leg pain is like Charlie horses, and the back pain is just every day, all the time, most of the time.
Did any doctor tell you have spinal stenosis?
Pardon me?
Did a doctor do an MRI that showed that you have spinal stenosis?
I don't know what that is.
Okay. Did you get an MRI? You did, right?
I did 2 years ago, and when I had all this pain last Friday, I called and talked to the doctor, and my appointment for next week is canceled.
Yeah, that's perfect.
He's going to order another MRI.
Okay, that sounds good, Jay. Let me talk for a bit about what's going on with you. Number one, MRIs don't show back pain. I know people go, what? Then why'd you get the MRI? The MRI shows a herniated disc, it shows a disc bulge, blah, 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 and that's my back pain. No, it may show that you have impingement on a nerve that can cause leg pain. Now, you had your legs locked up for a few minutes, but the fact that they're gone means it's probably not impingement of a nerve, okay? I don't know what it is yet. I would have to put my hands on your legs to see where that's coming from. And the back pain we can typically get rid of no matter what your MRI says, okay? So I have to examine you. I can't tell you a darn thing over the radio, but if you want to come in, the phone number is 800-300-9300. And if you want to email me, you can go to my website, which is www.lastemcells.com, lastemcells.com, and I will fire back another email to you. Okay? We can help get you on your path to being healed. All right?
Okay. I have one other problem with this mess. I try to go walking, and if I walk, say, 50 yards out and 50 yards back, my hips start bothering me just at the bottom of my rib cage, my hip joint.
Okay.
Just start aching really bad.
Okay. So
I'm walking about maybe 100, 150 yards.
The bottom of your rib cage is not your hip. So
well, below that, in my hips.
Okay. Well, I have to look at that because what you call hips may not be what is medically your hips. And that's something that I have to discover by my examination.
I can show you where it hurts.
Yeah, you can show me where it hurts, and then I'll examine you, move you around, and then we'll see where it's really coming from. But that doesn't sound like your hips.
Okay. Well, I have Blue Shield, so I'll call and see if I qualify.
Yeah, good.
I've listened to you.
Wonderful.
And I know you say that you accept Blue Shield. So
we do. We take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, but that doesn't mean that your particular policy is covered, that we take it. There's so many different kinds of insurance that it's very complex. So
yeah, I know that ISPs, it really messes things up.
It messes things up is right. But if you call the office, they'll give you an insurance verification right this minute if you want. They'll let you know whether we cover you or not.
Okay, I'll call them Monday. I'll do that.
You can call them now. 800-300-9300. We work around the clock.
Okay, I'll do that.
I've got great staff.
I'm sorry?
We have great staff. I mean, there's people by the phones right now. You can call up now.
Thank you for your call, Jay.
God bless you, Jay. It's good hope ahead for
Thank you.
Yeah.
Absolutely. Our number is 866-870-5752. I have lines open for you, but call now because the hour goes by quickly. Should we talk about a couple other things going on in the office?
I hope it's not going around.
Yeah, I just have trouble with words sometimes. It's my allergies. I think it fogged my brain today. But we do have a couple of exciting things, especially if you're overweight and you want a solution.
Yeah. I have people come in every single day because of our, what do we have, an epidemic, you'd call it, of obesity in this country.
Oh, yeah.
And
all across the country.
Yeah,
absolutely.
I would say 2/3 of the people at least that come in are overweight. And if you've got lower extremity, hip, knee, foot, leg, toe, whatever it is, foot pain, I'm going to ask you to please not get mad at me and let me talk about your diet. And I explained that carbohydrates are the killer of our society, and they raise our insulin and cause inflammation, and they also store fat. So when you have high insulin, you are storing fat. If we can get your insulin low by cutting out the carbs, you eat your own fat. You go into ketosis. Everybody's heard about the keto diet. Well, I've been doing that diet basically my whole life. Not 100%, because I end up getting so skinny that I actually have to add some carbs back into my diet to keep a good weight. So I'm about 6 feet, 170 pounds. That's a good weight for me, and I keep it balanced. But if you're overweight and you come in with arthritis in your knee, you should know that you are causing your own arthritis. Yes, that's crazy, isn't it? So we have a diet in the office. If you don't want to do it on your own by cutting your carbs out and just eating protein, veggies, and water, we have something called the Ideal Protein Diet. And it is so easy, and everybody who does it loses about 15 to 20 pounds per month. And the other part of this that's so important, if you're 1 pound overweight, that's an extra 4 pounds on your knee. If you are 50 pounds overweight, 50 times 4 is 200. You've got 200 extra pounds biomechanically on your knee. Guess what that's doing? That is causing you arthritis. So please don't kill the messenger. That's me. I didn't decide on the laws of physics. I think...
You didn't?
No, not yet I didn't. So...
Okay.
Yeah, just listen when I talk to you. Tell me to shut up if you want. And, I'll stop talking about nutrition. But it's just for your own good. Do you want to go to Fernando?
Yeah, let's go to Fernando in Mission.
Okay, Fernando, Dr. Marc Darrow, I understand that somebody told you a bone on bone in your shoulder. Is that correct?
Yeah, correct. And it's very discomforting, and it's hard to sleep, to be honest with you.
Okay. And
Mike, can you hear me okay?
Oh, yeah, we hear you great. Thank you. So I have a couple questions for you. Can you move your arm?
Go ahead. Yes.
Okay. If you can move it, it's not bone on bone. Bone on bone means there's no cartilage. No cartilage is like two bricks rubbing on each other. They don't move. So I hear the term bone on bone.
Well, according to...
Wait. I hear the term bone on bone all day long. People come in, new people come in. I've got bone on bone. I've got to have surgery. We fix them because it wasn't bone on bone. Bone on bone means that you're not moving. There's a little cartilage left in there that's allowing you some range of motion. Can we help that? Usually, yeah. No promises. Now, you were going to say something, and I cut you off. I apologize. Go ahead.
Yeah, well, I had the x-rays done by a doctor, and he told me that it's bone on bone, but or maybe it's right on bone, and I did get those injection shots. It's like a gel.
Yeah, that's hyaluronic acid. It's a
on
lubricant.
My shoulder, and it worked pretty good for like a month.
Okay.
And it just wear out.
Yeah. Well, if you want to get things working better, in my book, you're going to use regenerative medicine. You're going to use platelets from your blood, and you might be doing bone marrow from your pelvis to get stem cells, or you might be doing umbilical cord stem cells, which is the easy way now. And not only does that help the shoulder produce hyaluronic acid, but it also grows the cartilage at the same time. And I'm thinking, without examining you, that's going to be the way to go, but I can't tell you over the radio. I need to examine you and see what's going on. If you want to come in, the phone number to the office is 800-300-9300.
And where are you guys located at?
We're in West LA, across the freeway from UCLA on Wilshire Boulevard.
Okay.
You know, for you, why don't you go to the website? It's www.lastemcells.com, www.lastemcells.com.
Okay.
You can watch me doing video. There's videos there of me injecting shoulders. You can see if you want to do it.
Okay, that sounds great. I appreciate it, and I'm going to try to make that appointment. Hopefully it works out.
Yeah, and the fact that you had hyaluronic acid and made you feel better for a month, to me, means that we can help you quite a bit, and that it should last, not just for a month.
All right.
So good hope for you, and God bless you, Fernando. Appreciate
Thank
your
you for
call.
your call, Fernando. Appreciate it.
All right. Take care.
You as well. 866-870-5752. And you get that free book, and you don't want to miss out on that. Regenerate, Don't Operate is the subtitle. It's all about stem cells and platelet-rich plasma, known as PRP. And we are here Saturdays at 10 a.m. and at 1 p.m. And the website is www.lastemcells.com. That's lastemcells.com. So get busy and do your investigating and get to the office. Get out of your chronic pain. It's not fun.
No, it isn't. I've been there. You know, before I learned about regenerative medicine, I was miserable. There was a point in my life in my 40s I could not do sports. I was a wreck. And thank goodness this has saved my sports life. And that was a long time ago. That was 30 years ago, and I'm still using this stuff on me. So we have a couple callers coming in. Can I do a quickie question here?
Yeah,
or should we grab
talk
somebody?
about the facelift that
okay, the
your
vampire
wife does in
facelift,
the
yeah.
office.
Michelle Darrow is a nurse practitioner. She does the vampire facelift, which is similar to what I do. She does it on the face. I do it on the joints, ligaments, and tendons. But the idea is the same. It grows back the collagen. Her procedure makes people look good. It regrows the collagen, and as we get older, we know that shrinks up and dries up, and our faces don't look quite as good as when we were young. So that's an amazing process. And I admonish people to take a look at our website. You can see a video of her doing that. And it's called the Vampire Facelift. Very wonderful treatment to do.
Yeah, we have a lot of really modern, exciting things going on here in the medical field, not the least of which is what you do, which is stem cell and platelet therapy. Pretty exciting stuff, I would say.
Those callers, their names aren't showing up.
Well, that's true, but we have to wait for that. So here's one thing that you had said something earlier I thought was pretty important, that when people get told they have bone on bone, that's not necessarily correct.
Well, it's not. I mean, I just explained that. Bone on bone means nothing. It's just a doctor saying, I need to operate on you. Let's go to Matt. He's got PRP for hair loss is his question. Go for it, Matt. What's going on? You losing some hair?
I've listened or tuned into your show here and there on the weekends, and the PRP therapy I'm interested in hearing, and its effectiveness with hair loss. 49 years old, very healthy.
Yeah. Yep.
So just give me some input there.
Okay, the first input I'm going to give you is that if you were to come in and see me, I would check your labs and check your hormones, because hair loss in a male who's 49 years old is often related to a high dihydrotestosterone. Have you ever had a prostate exam?
It's been a while.
Okay. Did the doctor say
no, I haven't.
You haven't? Okay.
Yeah.
Oh,
Go
I'm
to
so
the
sorry,
go to the
we're
website,
totally out of time.
email me, and I'll get you all the information you need, which is www.lastemcells.com.
Thank you, Dr. Darrow, and thank you, Wilbur, Alex, and Nick behind the scenes, and everybody else who makes this show possible. I'm your host, Nita Valens. Remember to tune into the Pet Show from 11 to 1 on Saturdays, and we'll see you next time.